Well, today India is at 3,32,424 cases. That's 11,502 up in the last 24 hours. The recoveries are also up. India is now over 51% recovery rate. A total of 1,69,798 people have recovered. The deaths also now nearly at 10,000, a rise of 325 in the last 24 hours. And here's a worrying figure. India has surpassed the United States in daily deaths. That's in the last 24 hours. Let's just look at that number. Well, there we see Brazil is the highest deaths in the last 24 hours of 612. India at the second ranked here, 325, followed by the US there as well. So India now at number 2, though of course in the rise of cases in the last 24 hours, India still at number 3. So there we have those figures. So those figures are worrying. Let's also look now at how the big focus really is about how the cities, India's urban centers, now these of course are the main centers of growth as well. This is where the COVID cases are really spiking. Let's take a look at that. Well, we look at Chennai, Delhi, Mumbai, Bengaluru. Mumbai's rate of growth is lowest versus Chennai and Delhi. Chennai growing, and they've acted fast with the lockdown. Delhi growing, but the Chief Minister saying there's no need for another lockdown here at all. Bengaluru having some success, but Mumbai's rate of growth down, though the overall cases and deaths are still the highest. So the big worry remains that are Delhi's hospitals, like let's just look today at the Chief Minister saying that there's no need for another lockdown, but are Delhi's hospitals ready to cope? Sukirti has a special report.
Delhi's big private hospitals asked by the Delhi government to put up big boards with information on beds. 4 hospitals were found displaying these at the entrance: Max Hospital Patparganj, Fortis Hospital Sukhdev Vihar, Apollo Hospital Sarita Vihar and Batra Hospital Tughlakabad.
When we came to the Holy Family Hospital in Okhla, there was no information displayed anywhere at the entrance or in the open area that would tell us how many beds are available here or how much the treatment here would cost. However, in the reception area, there was an LCD screen that had information on the availability of beds. There was no information anywhere on how much the treatment would cost. When we inquired about it and asked the hospital authorities, they told us and they put up a small paper printout of all the treatment costs. But we inquired further and asked them why it was not there on the LCD screen, and we were told that it would also be done in some time.
A startling figure: 70% of the total beds in these hospitals were occupied. There is an extreme shortage of ICU and ventilator beds. In the 5 big hospitals that we visited, only a total of 3 ventilator beds and 5 ICU beds were available. In terms of the cost of COVID treatment per day, it ranged from 10,000 rupees to 30,000 rupees.
The government is currently considering a cap on the prices of treatment at private hospitals. And to resolve the issue of shortage of beds, 20,000 beds are set to be added in the next week across hotels, banquet halls and railway coaches. In New Delhi with camera person Sachin Gupta, this is Sukirti Dwivedi for NDTV.
Well, tonight, let's hear from the top doctors, the people in charge of India's top hospitals. What do they feel? Are hospitals under pressure? Will ICU beds run out as India is nowhere near its peak yet? Joining me tonight, I'm joined by Dr. Hemant Deshmukh. He's the Dean of KEM Hospital, Mumbai. Now, Mumbai, of course, KEM Hospital is the largest government hospital dealing with COVID cases. I'm also joined tonight by Dr. Mohammad Rela, who is Chairman and Director of the Dr. Rela Institute and Medical Center, Chennai. So I'm also joined by Gautam Khanna. He's the CEO of PD Hinduja Hospital and MRC. I'm also joined by Dr. Trikha of AIMS. He's in charge of the clinical managerial focus of COVID centers. Thank you all very much for joining me. Dr. Deshmukh, let me go across to you first, because really KEM Hospital has been the epicenter of dealing with COVID cases. What do you see the situation today in Mumbai?
Today in Mumbai, that for the last 4 or 5 days, what we are observing is there is a steady decrease in the number of admissions of critical patients, and I'm really happy about it. But the number of patients who come with positive and with symptomatic manifestations have definitely increased a bit. But the number of ICU beds and critical beds is not so critical as of today.
So you're saying that's good news then, that there's actually been a drop. So we've seen that even Mumbai now...
Yes, definitely.
What do you think has actually worked, sir? Because this, of course, is coming at a time when Mumbai is opening up today. Even local trains have begun partially for essential services. What do you think has worked in Mumbai?
There are three strategies which worked very well in Mumbai. First is the containment zones of areas which were really high density population, which had a migrant population also, a closely knit, dense population, and people were really cramped into a small space. And these contributed to a large increase in numbers in the initial period. But later on, when the zones were contained very well, most of these areas showed a steady decline in the number of positive patients.
Right. Let me go across now to Dr. Anjan Trikha of AIIMS, because I think in a sense, Dr. Trikha, what Mumbai has gone through, Delhi is facing now. It's very happy to hear that Dr. Deshmukh saying in Mumbai there's a less requirement now for critical beds, but in Delhi it seems to be rising. How would you see the situation today at AIIMS? Sorry, we'll just come to Dr. Trikha. If I can go across to Mr. Gautam Khanna, CEO of PDU Hinduja Hospital. Mr. Khanna, now Hinduja Hospital, one of the largest private hospitals dealing with corona cases in Mumbai. Do you agree with Dr. Deshmukh's assessment? Are we better off today in Mumbai, or is it too soon to say that?
Sonia, I have to say that I'm happy to hear Dr. Deshmukh, what he talked about. All I can say is in the last month and a half, there has been a lot of coordination with the government and private hospitals together. So there has been a lot of effort to identify extra capacity in private hospitals. To give you a perspective, our association hospitals, we committed to add another 2,300 beds and around 385 ICU beds to the government support. And that has been done. And hospitals like ours, for example, we have dedicated a separate building for COVID. The challenge here, I think, for us to understand is that not all hospitals can be converted into COVID facilities, because COVID requires negative pressure and special isolation facilities. So you need to plan for separate areas, and you need to ensure that there is no mixing of positive cases of COVID with the non-COVID cases. And also, when a patient comes to a hospital for any reason, then you need to do the trial, and you need to put them in a holding area, and then you decide whether they go into COVID positive or a COVID suspect or a COVID or non-COVID area for ICU or ward. So there are multiple challenges in a hospital like that. The thing which had affected all of us in the past couple of weeks is because of lockdown and a lot of staff getting infected. There was a shortage of staff, and number of operational beds had come down. So slowly the staff is coming back, so that is a good thing. And the other thing is, a lot of hospitals have learned. For example, we've learned that we have a dedicated number, we have a dedicated customer helpline, we have been coordinating, and a lot of education required for the patients. So if I can just take a minute explain to you.
So you're saying major learnings there, as Mumbai now has really seen the brunt for 2 months at learnings there. But let me just go across to Chennai, because that's a city now which has announced a major new lockdown. Dr. Rela, do you think that was the right decision? And what is the situation? Of course, we know that Chennai's health system is amongst the best in India, so that also is important. But how is Chennai coping with the rapid spike in cases? And do you think this tough new lockdown was justified?
I'll go to the question of lockdown in a minute. I think the situation in India is, the situation in Chennai is that we are getting about, Tamil Nadu is about little less than 2,000 cases a day. And this has been like this for the last 4 to 5 days. And I think the government is reacting to curtail this, and they feel that a lockdown is justified in order to bring the numbers down. Now, there is a lot of worries that there has been a worry that there are lack of beds for patients. The government actually has created a lot of beds in all the government hospitals. I think at the moment, they may be pretty full at the moment. Now, the private hospitals actually have also come into the system now, and the governments have allocated many beds in the private hospitals. Currently, really, the corporate hospitals are the ones which are taking on patients, and the next would be the medical college hospitals. The medical school hospitals have got huge pool of beds, as much as the government pool actually. They all are medical schools with over 1,000 beds, most of them, and there are probably about 7 or 8 of them in Tamil Nadu. So I personally don't think there is going to be a huge issue with bed availability. We need to wait to see how many sick patients are going to come. It's only when sick patients are going to be admitted, we are going to have a real problem. And I'll talk about ventilators and the staff available. The problem is most patients prefer to go to specific hospitals. If people want to go to specific hospitals, then there will be a shortage of bed because everybody is pushing in to go to their favorite hospitals, and their favorite hospitals are going to be filled up and their ITU beds are going to be filled up. Then it's a problem. But if you look at the bed availability itself, currently I don't think it's a major problem. And maybe we may just about get away without requiring more beds for most of the patients.
So let me ask, so you say the beds issue will not be a major problem, but the bigger challenge also of trained staff, the challenge of healthcare workers falling sick. Let me get in Dr. Trikha of AIIMS now. Why is it, Dr. Trikha, first in Mumbai a month ago and now in Delhi, that we are seeing these horror stories of patients dying in ambulances, desperate patients going online saying we can't get beds, AIIMS is only for VIP patients. How would you respond to that? Also, of course, that the major focus so far has been government hospitals fighting the major part of this battle.
See, I think I don't agree to what you say. Yes, AIIMS is for VIP people, but every citizen of the country is a VIP for me. There are hardly any VIP people in my ICU or in my wards. All patients are VIP for us, and they're all citizens of the country. If somebody who is known to anybody, or let's say a security man who works in my hospital is a VIP for me, every healthcare worker who works in my hospital or anywhere else is a VIP for me. So that thing that only AIIMS is for only VIP is not correct. Second thing is, you've just heard, people really want to go to one specific hospital. There are so many other beds available, and we have helplines for doctors all over the country, all over Delhi, where they can contact us and talk to us, so that they can get expert advice. You already are aware that people will go into ambulances and go to 4, 5, 6 medical government or public hospitals.
Right.
That's where the problem arises. One should go to the nearest hospital. There are designated hospitals, and I can assure you, majority of the time, the initial treatment is supportive, which every hospital can give you. The majority of the time, it is oxygen and oxygen-related administration protocols which are there for everybody to see. The other problem which I envisage, sorry, I'm stopping you, is that we need not only beds, we need not only ICU beds, we need healthcare workers. We need people to work on those machines which you are buying. We need people to take care of the people who are on the beds, who are unable to walk, who are unable to breathe well. Who is going to take care of them? We need to think about that.
Absolutely. So the point of shortage of trained personnel, and I think it's a very important point you made, that nobody is a VIP here. Every citizen is a VIP. But I just want to, and in fact, the big worry is being that, and I want to bring in Dr. Deshmukh here, the big worry is that whether Delhi will see a situation like what was in Mumbai just about a few weeks ago. And I know that you have talked to this, Dr. Deshmukh, but those videos which had come out of those body bags along with patients in a ward, maybe because of shortage of staff to remove them, but those videos were really horrific. Are we going to be in a situation, and I make this point earlier, that it was the government hospitals which were the first frontline hospitals, the real warriors to actually help in handling this COVID outbreak? Are we going to see now a similar situation happening in Delhi? What would your advice be to doctors in Delhi today, so we don't see such horrific scenes repeated?
Yes, there are 3 things which happen once the pandemic opens up. The number of deaths that come with serious patients. I'm talking about patients who don't have mild or moderate symptoms, but I'm talking about patients who come with critical conditions, something like ARDS, acute respiratory distress syndrome. Most of these patients do not really come to the hospital entrance well in advance. They come only at the end of 48 hours, 72 hours, or maybe 96 hours after the onset of symptoms. And the earlier you reach a hospital, the best treatment can be had only when you reach much earlier, not in the later stages of the disease. What happened in Mumbai was, initially none of the people realized that they had COVID. Most of them stayed indoors, and once they realized that they were turning critical, that they were turning breathless, most of these patients rushed not nearest to the not to the nearest hospital, but as somebody said, to the best hospital or the hospital which they were really accustomed to. And everybody in Bombay rushed to KEM hospital, and that's the way when patients were really brought dead. Most of these patients were, in fact, we couldn't resuscitate also. And these patients dying within the first 12 hours, 24 hours were patients who had a lot of comorbid conditions like diabetes, hypertension, hypothyroidism, obesity, amongst others also.
And that people know that situation now, so they're not coming in the last stages. But let me just ask, and I want to bring in Mr. Khanna of Hinduja Hospital. So in a sense, is a patient sometimes caught between the devil and the deep blue sea? It may well be that the rush is for the big government hospitals, whether it's KEM or AIIMS, but when you go to Hinduja or to a private hospital, your worry is that are private hospitals making money out of this situation now? We see absolutely astronomical prices for PPE suits. This is the time when the private sector should not be cashing in.
So, Sonia, I can tell you about Mumbai. I can't say about the rest of the people. In Mumbai, 80% of our beds are at government regulated rates, and government regulated rates are actually very, very low, lower than the costs of what is the treatment in private hospitals. So you can assume that private hospitals today are doing a highly subsidized rate. The cost of PPE is there. But I can tell you from what we know from the association that most of the hospitals, or almost all of them, have not increased their prices from what it was in December 2019. Only additional cost is the PPE. The effect is, the issue is, Sonia, if you are not, don't have the capacity to pay, that even 10 rupees or 100 rupees or 1,000 rupees is more expensive if you have only 5 rupees. So the issue is, if you don't have adequate insurance, you are concerned. People till date have not focused on health as an important part of their life planning. They have only focused on savings and investments, on financials. So if you start focusing on health insurance and focus on what you need to pay for adequate quality, because each hospital is different. They have different equipment, different quality of service, different staff, different levels of overheads. So costs will vary. But I can tell you from what we know in the Hinduja Hospital, of course, you know that it's quality for all, it's a charity hospital, and most of the hospitals are not doing any profiteering. It is the question of ability to pay what people were paying pre-COVID, paying post-COVID.
Hospitals, private hospitals not doing any profiteering. Well, we'll get patients also to respond to that. But I think one of the problems is that some of the weaknesses in India's health system shows up at a time like this. 80% of India's health sector is in private hands. What are the issue on costs at a time like this? The Supreme Court is going to hear a PIL on regulating rates. So all those are larger issues. But a quick last round of question to all the doctors on the panel today. We just reported that India today had the second highest deaths in the world in the last 24 hours. We know, of course, India's cases are spiking at this time. We're not near our peak. Should there be some version of a lockdown again? Chennai has announced a very tough lockdown. Dr. Rela, first to you. Should we be looking now that perhaps our lockdown came too early, that this is the time when India needs to look at much tougher restrictions? Dr. Rela.
I believe that the early lockdown that we had was a huge advantage to our country. The reason is it actually delayed the peak of patients significantly, that we are all getting ready really now. And it has given us a huge advantage. The other problems are that there may be not such severe cases like we saw in Italy, the United States, or whatever, United Kingdom. That's another thing. But if things get out of control now, as we speak, and if the numbers are going up, that the health system is not going to cope, it may be an advantage to actually do a lockdown again. So you can actually flatten the peak once again. You may not be able to flatten the peak like we did right at the beginning when we actually did the lockdown. So the first lockdown actually delayed everything for India by almost 6 weeks to 8 weeks. Now we are starting a peak, and I think the second lockdown that they have announced in Tamil Nadu may be an advantage in order to slightly reduce the peak, so we are able to cope with this, with the whole thing which is going to come. I think it's an advantage.
Dr. Trikha, we see so many projections now coming out every day, but the Delhi government just said a few days ago that we will have 5.5 lakh cases in Delhi by mid-July. Do you think with estimates like that, you would prefer it if there was some kind of version of a lockdown in place? Just today we know that Delhi said that there's no question of another lockdown. But what would you see? Should it be city specific rather than all India specific, that in Delhi when cases are rising there should be another lockdown?
Yes, I'm very clear that as a doctor, first of all, I'm not good in economy. Somebody up there who is good in economy and would also like to balance out the medical problems and the economy has to take a call on it. However, you are perfectly right that we should have lockdown, not even a state-wise phenomena, but a city-wise phenomena. And then the second important thing is, if ever we plan a lockdown again, the first one was planned and it was a success. Mark my words, it was a huge success. We were dealing with a disease about which we didn't know anything. We are still learning about the disease. Every day new things are coming out. If at all somebody thinks about a second lockdown, it has to be area specific, and you have to have, and we all have clear-cut aims and guidelines that if we have a lockdown, what are our aims? What are we going to do? What are we going to achieve? And when do we end it? Because we really can't go on and on and have a two-year lockdown. Absolutely. We have area-specific lockdowns and we have aims during that lockdown period that what are we going to do and when are we going to stop it.
Well, there it is. We heard it from the doctors. Thank you all very much for joining me tonight.